Hi everyone, welcome to my channel. So first I will start with the pharmacology topic. Before starting any chapter, I would prefer to start the detail about the pharmacology. So without wasting the time, I would prefer we should start the detail about the pharmacology. What is exactly this pharmacology? It's a basic principle. Okay, the pharmacology basic principle is it's a study of a drug, its action, its dosage, its therapeutic use, and its adverse effect. As we all know, the drug have adverse effect as well as good effect. Okay, so in pharmacology, what we will study more, we will study that directly linked to the this pharmacological drugs. It's directly linked to the pathophysiology of a particular disease. Okay, what is drug? A substance that changes the biological activity in a person. It can be in the form of natural source, plants, animal, microorganism, or maybe synthesized. Okay, now moving towards the more detail about it. Okay, so in pharmacology, we will study about the drug. Okay, for what reason it's prescribed? Drug may be prescribed to promote the healing, cure the disease, control or slow the progression of disease, prevent the disease, decrease the risk of complication, increase the comfort level, and reduce the excessive activity in the body. For example, sedatives. Okay, sedatives, it causes the sedation, and by causing the sedation, it reduces the excessive activity in the body. Now, drug effects. Okay, what is the drug effect? So, the therapeutic or the desired effect is called the good effect of the drug, and it leads to the stimulating or inhibiting the cell function or block the effect of biochemicals in the tissue, for example, antihistamine. Now, physical and mechanical action like laxatives. Okay. Now, unwanted effect on the body, that is called as side effects. For example, we'll consider the same example. Antihistamine may cause dry mouth. It's a mild effect, but some drugs have a dangerous or life-threatening side effect as well. Okay, so for example, excessive bleeding. Okay, now what is the over the counter drugs? OTC, which is called OTC drug that an individual can purchase without a note from the doctor, means the drug that the individual can buy from any of the pharmacy without the doctor prescription, but still it's recommended that doctor be consulted when there are other medical condition, means any critical illness or something. So instead of buying any OTC drug, okay, one should consult with the doctor and take a proper prescription, okay, before buying the medicine. What is a prescription? It's a note that the doctor write that details about the doses and instruction. Means the doctor, whatever the drug the doctor prescribe and in which doses form has to be taken and how many times should be taken, that is the paper, the note is called as prescription. So here is written note that the doctor write that details the doses and instruction. Okay, what is this adverse effect? Okay, every drug have the side effects. So what is this adverse effect? What can be the adverse effect of any drug? There are so many. Here we are seeing the few. For example, hypersensitivity or the allergic reaction. Okay, for example, rash to anaphylaxis, like simple rash to anaphylaxis reaction, that is a very high level of sensitivity or allergic reaction is called as anaphylaxis. So in that condition, patient should stop taking the drug immediately, okay, and the physician should be contacted at earliest. Now, what is this idiosyncratic? It's an unusual and unexpected reaction to the drug. Means this kind of reaction is not shown by each and every patient. In few patients, according to their body types, this reaction comes in few patients. Okay, examples like excessive treatment after taking a sedatives. Oh, I'm so sorry. excessive excitement after taking the sedatives. Sedatives slow down the, your excessive excitement. It causes a sedation, but in some patient it causes the excessive excitement after taking sedatives. It's very unusual side effect. Okay. Now, iatrogenic means the negative effect on the body due to the medication error, drug overdose, or unusual response. Okay. Now, teratogenic, it's a harmful effect on the fetus leading to the developmental defects. Means if mother has taken a drug, okay, and it causes the side effects on fetus. Okay. So this is, and because of that it leads to the developmental defects. What is this drug interaction? It's very, very important topic. It's very important. We will study in detail about it. So here just a small note. What is drug interaction? So drug effect is modified by two things: combining it with another drug, food, or other substance. For example, aspirin, antacids, alcohol. Okay. So there are two things: antagonism or agonist. So synergism is a agonist process. What is doing? When the combination increases the effect of the what has been taken. Means if we have taken one drug and then we are taking some other drug, and two drugs interact with each other and they increase the effect of first drug. So the first drug effect is increased by the other drug. So that another drug is called as agonist in that case. Sometimes it can be a life threatening, okay, because excess of anything is not good. Antagonism, when the combination of drug decreases the effects. For example, here we can see the presence of the antagonist prevent the patient from receiving the beneficial action of the drug. Okay, so it's a problem because we want some good effect of that drug which we have taken already, but we have taken some other drug. So then what happened? It prevent the patient from receiving the beneficial action of the first drug which you have taken. So in that case the drug is useless for the patient. Okay, but sometimes it's useful. How? Required as an antidote. Okay, if we have taken by mistake some wrong drug, so or we have to reduce the action of some drug, then in that case this antagonism process, or we can say this antagonist drugs can be very useful and it work as an antidote. Okay, so till here we finish the drug action.